Hi, I'm Dr. Matosian. People often ask about the best way to put drops into their eyes. There's a right and many wrong ways of instilling drops into the eye. This video is going to teach you the correct way to use your eye drops. We will give you some powerful tips to succeed. Most eye drops come in bottles that have screw-on caps. Always check the color of the cap, as the color designates the type of medication inside the bottle.
Next, make sure the name on the bottle matches the name on the instruction sheet provided to you by your eye doctor. Please make sure not to touch the tip of the bottle to your eyelids or eyelashes. Also, please make sure that nothing gets inside of the cap. The bottle tip and the inside of the cap are sterile. Bacteria that gets on these surfaces can grow in the bottle and contaminate the drops.
Some eye drops come in vials where you have to break the cap off before use. These vials are meant to be thrown away after a single use. That's because they contain no preservatives. Throwing the vial away is what's recommended and what's approved by the FDA. But to save money, some people like to use these vials more than once. If you're going to do that, here's what I'd recommend. Please note that it is not FDA approved to use the vial more than once. But if you're going to use the vial again, once it's open, store the vial with its tip upright inside a clean shot glass or other narrow container to avoid the tip from getting contaminated. Keeping the vial in the refrigerator will also minimize, but not entirely prevent contamination. You should throw the open vial away after 24 hours.
Okay, here's how to put drops into your eyes. First, wash your hands. Then tilt your head back as far as possible. Sometimes laying down makes this easier. If you're right-handed, hold the eye drop bottle in your right hand between your thumb and index finger. Use your left hand to pull down your lower eyelid to make a pocket between your lower eyelid and the eyeball. Tilting your head back makes this pocket more exposed and easier to hit with a drop. That pocket, after all, is where you're aiming for the drop to fall. Rest your right wrist on the knuckles of your left hand. This gives your right hand better control and better stability. Hold the bottle with the tip pointing downward about an inch or more above the pocket in the lower eyelid.
Don't let the dropper tip touch your skin, eyelids, eyelashes, eyeball, or the inside of your eyelid. Squeeze one drop and let it fall into that pocket. You can do the same maneuver for both eyes. Getting the drop on the forehead or the cheek does not count. When you are new to using eye drops, you may miss the target. If you miss, try again. Practice makes perfect. If you're struggling with the two-handed technique I just described, here's another way that's not quite as good but works for most people. Look up towards the ceiling or lie flat if you prefer, and keep your eye gently closed. Let the drop fall in the little valley around the inside corner of the closed eyelids. Then open your eye and gently blink a few times. The drop will roll down into the eye. Though it's not ideal, this way is better than not taking your eye drops.
By the way, there's never a reason to put more than one drop of an eye medicine into your eye. The eye can only hold one drop at a time, so placing more than one drop in the eye at the same time is wasting medicine. Some people say they can't always feel the eye drop go into their eye. A good way to make this easier is to refrigerate the eye drop bottle. You'll feel the cold drop on the eye. It may actually feel very soothing. Also, if you have issues with the drop stinging your eyes, keeping them cold may decrease the burning sensation.
One last really important bit of advice. Immediately after you instill your eye drop, gently close your eyes for a few minutes. Why? Because it keeps the drop in contact with your eye at full strength for a longer time than if you were to start blinking. Keeping your eyes gently closed can more than double the effectiveness of your drops. So it is time well spent You should also wait about 5 to 10 minutes between taking different eye drops in the same eye. That way, the first eye drop can be absorbed instead of being washed away by the second medication. I hope these tips will help make it easier for you to use your eye drops successfully. I'm Dr. Cynthia Matosian.
I'm Dr. Priya Desai.
I'm Dr. Sebastian Lesniak. Thanks for watching.